Hello all, welcome. My name is Malar, working as an assistant professor in Department of Management for Soundarya Group of Institutions. In this video, we are going to learn about Healthcare and Information Technology Enabled Service. It's called, in short form, it is called ITES, and which is the module number 5 for Service Management subject of BBA 4th semester. This would be the video part 1. Later would be followed by other parts. So let's get started to learn about healthcare and its importance in ITES. The contents of this video would be about hospitals. In this content, we are going to learn step by step. The first point is about evolution of hospital industry. The second would be nature of service, followed by risk involved in health services, and the last one would be marketing of medical services. So let's get started to learn one and one in deep. First, it's about hospital. Hospital is defined as an institution for providing health care, but it's not always for providing longer term patient stays. It might be even for the short term patient stay. For example, we can say outpatient and inpatient. These are the two categories which is there in the hospital, where outpatient would come and go, will not stay in the hospital, but inpatient will stay for some time. Next, the hospital is a social institution because it is built for the society and the social welfare purpose. It might be of a recent origin. The word hospital might be of a recent origin, rooted in the modern medical model. But the history of medicine and surgery dates back to an earlier age. Probably we don't know when did the idea of medicine or surgery start. Even when the hospital as an institution were sick, can be taken for the treatment was absent. So we really don't know when did the medicine and surgery date back. But now we know that hospital is a very important social institution which is deep rooted in the modern medical model. Functions of a hospital. What does a hospital do? It takes care about 5 important components. The first component is health supervision and prevention of disease. It must supervise the health and also it must take care about the prevention of disease. The next is about education of healthcare providers. It must be doctors, it might be nurses, it might be dietitians, social workers, anybody who is involved into the healthcare system. Education of them would also be a function of hospital. Next would be rehabilitation. Rehabilitation might be any group of people. For them, rehabilitation will work only in the hospital because we will have social workers there, we will have psychologists there who will rehabilitate the deep sensed people into the common rational people. The next would be healthcare research. This is very important because research in the hospital or in the healthcare is very important because there are lots of diseases one by one. There are many diseases which is coming, and for them research is very important. And the last one would be investigation, diagnosis and care of the sick and injured. This is an important function of a hospital. So under this we could understand that it is 5 function of a hospital which is considered as a primary function of a hospital. Next, how did this development of hospital industry come up in India? As I said, hospital is a buzzword. This has come up in the modern day, but the hospital, or we call them it in the other way called as medicine or surgery, that did not happen in a correct date. So how did the development happen? The earlier, we can say that in the traditional medicine period, Ayurveda as a science of life. In India, it was there more than 5,000 years ago. That was the first period of science, that is healthcare science. Next comes the period between 1600 to 1947, which we call it as British colonial period. When then East India Company established and European medicine started to overtake our Ayurvedic medicine. But however, Ayurvedic was also become an integrated with the Western concepts of a healthcare. Next comes the period of 1980 onwards. This was the time where government gave all the subsidies, government started immunization program and private health providers also boomed up. Next stage is called about 1947 onward, that is after independence. What did it happen? This happened between the post-independence period where the government of India made efforts to recognize Ayurveda, Siddha and Unani. So all these were the classical medicinal practices of India. So government made efforts to recognize all these. And then, but however, the general tendency increased with the norms of modern medicine, with the Western medicine only. And next strata, the last classification will be 21st century. And today, the healthcare status of India is still on a developing level. The private sector is, however, dominating the government sector. A trend of medical tourism also developing and strengthening in 2000s. It is because tourism, particularly medical tourism, is increasing because we have the cheaper medical facilities compared to the other countries. Next, what is the present condition of hospital industry in India? As I have mentioned here four important points. The first one is about strong demand. I said general health awareness is also increasing. Lifestyle diseases have come up and increasing access to insurance. And these are the one, and increasing population is also might be an important one. So all these is representing a strong demand for increase of hospitality services in India. The second one is about attractive opportunities. The hospital industry is expected to grow CAGR of 16 to 7% to reach 8.6 trillion by financial year 2020, from 4 trillion to the 61.7 billion in financial year 17. So this kind of merger acquisition in the hospital sector and the private public partnership, which is increasing opportunities for the healthcare system providers nowadays. The next would be rising manpower, the number of doctors, the number of nurses, the number of hospitals. This is also increasing, and the education system, which is also helping up, boosting up this medical care, so that rising manpower is also a very good advantage which India is facing now. And the last one would be the policy support, the world's largest government funded healthcare system that is called Ayushman Bharat was launched in September 23rd, 2018. From then, there are lots of government initiatives which is taken. From then, the advantageous position of India in the hospitality care industry have risen. Next, the nature of service. What kind of service does the hospital provides? We normally say that it is medical service and surgical service, but there are other supporting services called laboratories, equipment, personnel that we always forget it. So whenever you think about the nature of service that the hospital give, don't think only in the terms of medical or surgical. Please also think about supporting laboratories, equipment and personnel. And hospital are the institution comprising basic services and personnel, usually departments of medicine. This covers a wide range of medical offerings from the basic healthcare necessities or training and research. So from the basic care necessities till the training and research, the hospitality services have grown up. Next comes the mix of services that a hospital might offer. See, there are different kinds of hospital which only takes care of the people with the common cold, flu, fever or something like that. There are some kind of hospital which takes care about only dental services. There are some kind of clinics which takes care only about ortho. But the mix of services what the hospital provide, it entirely depends on its basic mission or the objectives from which it is founded up. The services that the hospital offer include, as I said, there is no such hospital which was earlier, not now, which was earlier, we were providing all kind of services. But now there are different kinds of organization called health organization which provide a varied number of health services. Let's differentiate as what and how does the hospital offer services. The basic hospital service is about short-term hospitalization. That means outpatient people. Emergency room services for any emergencies, for any trauma, for any accidents. Next comes about general and specialty surgical services. Next is about X-ray, radiology services, laboratory and blood services like blood bank, blood donation and all. These were the basic hospital services. Next, we shall move on to the modern health care systems about health maintenance organization. These are the hospitals which add a number of special and auxiliary services to the basic list. It can be pediatric special care, the hospital only for children, greater access to the surgical specialist, physical therapy, rehabilitation services, prescription services, home nursing services, nutritional counseling like dietitian, mental health care like psychological support, psychologists, sociologists, family support services. We have counselors for them, genetic counseling and testing, social work or case management services. So see, these are the other special and auxiliary services which have co-joined into the hospital service nowadays. So these are the one which were included in the basic hospital services, and these are the one which is health maintenance organization is subject to give us in terms of health services. Next, hospitals funded by state, regional or local government. We all know that government hospitals are also there and private hospitals are also there. There are other kind of hospitals called as charity hospitals. So these are the hospitals will take care about primary care services, mental health and drug treatment, infectious diseases clinic, dental services, and the last one would be translator and interpreter services. So these are the one which will be taken care by the government funded hospitals, private funded hospitals, and particularly we will mention about charity hospitals. Now, the growing complexity of healthcare delivery and financing is creating new risks for hospital, because as I said earlier, hospitals did not provide a varied number of services, but as of now the PMO is providing the varied health care services. For that, new risks have been arisen in terms of health system, in types of physician practices and other types of provider organization. Let's understand that what are the important risks that the healthcare industry is facing now. This is the top 4. Some people categorize it as 10 risks. Some people categorize it as 15 risks. It depends upon us as how do we categorize. But here I have listed you the top 4 risks faced by the healthcare industry. The first risk is about the cyber threat. As we know that healthcare industry is undergoing change every time with the inclusion of technology, and this technology inclusion have implemented into the patients, into the facility management and everyday routines. So everyday whatever the hospital does, everyday management is included into the computer, and all these informations, what will happen, this informations or electronic records of a person, electronic record of a patient, of a hospital about a disease can be easily accessed. It can be normally accessed internally, but through approved third parties, the records might also go to vulnerable cyber criminals. This might, don't save our data which we give it to the hospital. That's the basic and the first risk what the hospitality industry is facing. Next would be the compliance lapse. What is the meaning of this? This says that today's healthcare regulatory environment is more complex than ever because it is putting facilities and higher risk of non-compliance, not following the government rules and regulations. As we all know, every day one or the other government rules and regulations have been come up, but following such kind of compliance is a task for the day. So healthcare organization and providers need to be fully aware of all laws and regulations that will apply to them. Next would be about healthcare illness. What is this healthcare illness? As we say that it is not difficult to imagine that one of the greatest risk of healthcare facility is spreadable illness and germs. Because whatever the healthcare people are taking care of, the diseases, the things, what is happening, that might be also exposed to the hospital staff. It might be the doctor who will take care, it might be the nurse, it might be any people who is into the healthcare industry is also associated to such kind of infection. So healthcare illness is also a risk, a greater risk actually, to tell you about the hospital risks. And the last one is about privacy management and information security. As I said, every hospital managing all the data in terms of the soft copy or in terms of the networking. So what is happening is it must be prepared to adapt and simplify such resources. But what is happening is to set up and share workstation too quickly, log patient notes and have general use password. This might go to the unsafer hands. In a time when patients need to be able to access their own records and data as well, this information must be made available to them online while still being protected without getting to the unsafer hands. That was the 4 risks which I said, and now we are listing up to the top 10 risks for 2019. This is taken from a slide which have done the research. So I will read one by one to make you understand as how this much of risk is being there in the hospital industry. First one is about regulatory changes and regulatory scrutiny. This is related to the laws and rules about the hospital sector in India. Whatever the rules or laws are being made, that must be followed according to the regulations. Next one is about privacy, identity management and information security. So whatever data is being shared from the patients to the hospital, to the doctor and about the disease must be taken into utmost care because that's a private issues. Next comes about the existing operations of meeting performance expectations, because everything is becoming digital now and the performance expectations from the hospital, from the doctor is very much increased now. Next would be the succession challenges and ability to attract and retain top talents. As we know, the top talents of the doctors or nurses or hospitals, what is happening is it is charging more or going to abroad, rather than the risk of today's world is to retain the talent in India. Next would be the cyber threat, which I already explained you now. Next is about the rapid speed of disruptive innovations and new technologies. The technologies and innovations are increasing day by day. We as a hospital industry, what we should do is we must keep up that innovation and technology updated. Otherwise, we will lose our clients. The next is about opportunities for organic growth. Everybody is now talking about organics and organic food. So if we also take care, if we do not take care about the opportunities of organic growth, then we will lose our potential customers. Then comes the inability to utilize an analytics and big data. As I said, everything is being computerized. We need to know about the use of analytics and big data system into our hospitality system. Next is about a resistant to change operations. So the mode of operations at that level and the mode of operations today have changed. People in the hospital industry must not keep their resistant to change their operations mode. And the last one would be the sustaining customer loyalty and retention. Once you miss the clients, once you miss the customer, they will never come back to you in a hospital industry, because there are large varied number of hospitals which has come up. So what is the last risk is to retain your customers. Now we shall jump on to the next topic, is about trends in hospitality industry or hospital industry. What is the upcoming trends? The government role, that is the first major task where it has come into the trends of hospital industry. The second one is about expanded the financial risk protection coverage, because insurance have come up. The next one is about private sector partnership through public-private partnerships. This PPP says public-private partnerships are gradually gaining acceptance. The next is about the significant demand and supply mismatch. As I said, health tourism have increased, but the supply from the our side must also increase to that matching, where demand and supply must match. Next is about new government initiatives like Ayushman Bharat and other government initiatives towards public and health safety. These are the trends in the hospital industry. And I can also say that 89% of consumers turn immediately to an online search engine when they're looking to solve their health queries. Whatever happens, we always search in Google saying that what is happening to us, where should we go, which hospital is good. Like that, 89% of consumers switch on immediately to check about their healthcare queries. And healthcare marketing is a strategy for doctors, hospitals and healthcare networks, isn't it? So what is healthcare marketing? It is a process of strategic outreach and communication designed to attract healthcare consumers, to guide them according to the healthcare journey and keep them engaged within the health system. So this is about healthcare marketing. The new norm of healthcare marketing and advertising. So it is not the advertising and marketing at the earlier point. Now the need and the new norm for healthcare and marketing have increased. Let's understand what it is. First is about, you must understand your new target audience, because all these are not generation X, all these are not generation Y, they are the mix of generation, and we must know what we are targeting. Next is about designing our website with patients and patient portals in mind. So you must design a website with patients, keeping in mind what patient is needed, because they are our end customers. Next is invest in healthcare. If we invest in healthcare, definitely it will gain us a good advertisement. Don't forget about paid ads. This paid ads has been a buzzword now because everybody is going for this while marketing the healthcare industry. Get social with social media marketing, creating videos to connect with patients, establish an email marketing plan, increasing the patient reviews, using texting, chatting and automated phone messages, and tracking the right data. So these are the new norms which have increased in marketing and advertising in towards the healthcare industry. I hope you have understood the new norm, and let's get understanding with the entrepreneurship of being a healthcare person. Next, what are the key points to highlight? The first key point is trust is the single important factor which comes in getting the new customer for the healthcare business. 75% of Indians use social media to research their health symptoms. As I said, anything which is happening will go on to the Google to check in. And 80% of internet users are searching for health information every time they Google for getting health information. And 72% of all internet users are active in social media. So if you're using internet, it's well and good. If you're using the social media, well and good. If you're giving the health information, very nice. If they're researching and you can give the answers through the social media, very nice. You can build up the trust with the hospital care services to them. I hope you have understood the video, and let's meet up in the part 2, the second video of hospital and IT enabled services class. Thank you.